Hi, Dr. Goldhamer, and welcome to the GI Health Summit. Thank you so much for being here.
My pleasure.
Dr. Goldhamer, so many people these days seem to be suffering from so many GI conditions. Why do you think that is? And more importantly, what can we do about it?
Well, before I answer that question, AJ, what we really should do is first look at the fundamental issue of why we eat.
Great.
The first question I think we need to ask is, why do we eat? Why do we even bother? It's just so much trouble, all that chewing and digestion, swallowing, chopping, shopping. Why don't we just say enough's enough and stop it? The problem is we actually need to eat. There are things about eating that are critical to our survival. We need to get calories. We need a source of fuel. If fuel was the only issue, we could just say, well, why don't we just figure out what's the easiest way to get calories in? That would be drink oil. Why don't we just get a cup of oil, get the 2,000 calories we need, and say enough's enough? The problem is, of course, there's more than just calories that we need from our diet. We also need water, since we're mostly water. We also need a source of protein for its essential amino acids. We need fat for essential fatty acids. We need vitamins. We need minerals. We need fiber. And we need phytochemicals. So whatever diet we put together, it needs to have an appropriate level of these various nutrients. Now, some people say, well, why don't we just drink some oil and a little bit of water, take a protein supplement, a vitamin pill, a little bit of tree bark, and call it a day. It turns out we don't only need to get enough of these substances, but we also need to avoid getting too much. And that's particularly true with things that we are best avoiding. For example, animal foods, meat, fish, fowl, eggs, and dairy products. Although they're very rich sources of macronutrients in terms of fat and protein, they also have some untoward effects, particularly when consumed in significant quantity. There's all kinds of challenges with animal products, and that's why in the diet that we recommend, animal products are avoided. There's also highly processed foods, essentially chemicals that are added to food that fool the satiety mechanisms in the brain and lead to systematic overeating. And that's essentially why people are fat, sick, and miserable, is because they add these chemicals to their feed, they overconsume their feed, they develop obesity, metabolic syndrome, and all the downstream consequences of it. You'll notice on my list here that dairy products get to be on both lists because they're both an animal food and a highly processed fractionated food that is kind of special. Problems with animal products include bacteria. I mean, if you don't cook your animal foods enough, you can die. Bacteria, major issue. There are viruses, including things like bovine leukemia virus, which cause cancer in cows. Now, they tell you, oh, don't worry, you're not a cow. And that's exactly what they said about prions, the active component in contributing to Creutzfeldt-Jakob disease or mad cow disease. They said, don't worry about prions, but now, of course, we know that they are a big concern. Heavy metals, growth stimulants, and hormones, antibiotics, all fed to animal products, biologically concentrated in their tissues. And of course, when you eat higher up the food chain by consuming these substances, you get their lifetime accumulation of poisons in each mouthful. Pesticides and this whole idea of biological concentration. If you just break it down calorie per calorie, animal products could have 2 to 1,000 times the concentration of various chemicals as a consequence of biological concentration. So we recommend avoiding animal products. And when you avoid animal products, you also avoid a lot of the consequences that occur from consuming them. But the reality is that 93% of the calories that are consumed by people in industrialized countries today are either animal products or highly processed fractionated foods, salt, oil, sugar, flour-based products. So only 7% of foods now come from fruits and vegetables. And actually, of the fruits and vegetables, I think a third of that is potatoes, and most of that served as French fries and potato chips. So the reality is that the foods that you and I might think of as whole foods are actually such a small part of the diet, they're not even a statistically significant percentage of the calories consumed by many people in our society. And we are definitely getting fatter. I don't think these stools were the beginning of ergonomics. I think they were designed in a time when people's posteriors were of somewhat different proportion. I'll give you two guesses, which is the vegan. The reality is that 2/3 of people are now overweight or obese, and visceral fat produces all kinds of consequences to our health, including inflammatory markers. It contributes to heart disease, type 2 diabetes, stroke, breast cancer, colorectal cancer, Alzheimer's disease, and other problems. If you take mice or rats, for example, and you let the mice or rats eat ad libitum, and then you compare that to the mice or rats that have these chemicals added to their feed, chemicals like salt, oil, and sugar, you'll find the rats will increase their weight 49% in 60 days. And it's not for psychological reasons, it's biological reasons. The reality is that the only thing that exceeds the consequences of dietary excess, that is obesity, in terms of morbidity and mortality right now, is tobacco smoke. And honestly, obesity is rapidly catching up. Increasing consequences of dietary excess include diabetes. In fact, it's interesting, if you look at the relationship between increasing obesity and increasing diabetes, the correlation is almost 1-to-1. It's almost as if there's some type of connection. So what we're doing as a society is telling people, well, maybe they should eat health food, things like olive oil and red wine, dark chocolate, coffee, coconut, anything, diet sodas, the dead Dr. Atkins paleo keto type diet recommendations. And what I think we should be doing is getting people not to eat health food, but to eat healthy food. So fresh fruits and vegetables, grains, legumes, nuts, and seeds, a whole plant food, SOS-free diet. SOS, of course, is the international symbol of danger. It also stands for salt, oil, and sugar, the chemicals added to food that stimulate dopamine production in the brain and lead us to systematic overeating and these leading causes of death and disability. The leading cause of death, heart disease, cancer, and stroke. But the actual causes of death, the reason people get heart disease, cancer, and stroke, is tobacco, poor dietary choices, and alcohol consumption. So perhaps if we spent more of our time focusing on the actual causes of death, we could reduce the leading causes of death. The actual cause of death, number one, is still tobacco. It does a fabulous job because it affects virtually every organ system in the body. They say that some people claim that smoking actually could protect against lung cancer. And they'll cite statistics that show that only 20% of smokers actually get lung cancer, that 80% of smokers never get lung cancer. What they don't tell you is the reason why 80% of smokers never get lung cancer is in part because they die from heart disease before they live long enough to grow their tumors. So I guess if they could make smoking more dangerous, kill everybody from heart disease, they might be able to start advertising it as cancer safe. So tobacco is effective, and so is elevated blood pressure. As you see here, elevations of blood pressure are one of the leading contributing causes of death and disability. Alcohol consumption, they try to argue that alcohol is some type of health food, and if you don't drink, you should start. They talk about alcohol having powerful antioxidants like resveratrol, but forget to tell you that it comes from the skin of grapes, and if you wanted more resveratrol, one thing you could do is eat grapes. They also talk about that alcohol has a blood thinning effect, that it acts much like aspirin to thin the blood and reduce the risk of a clotting stroke. What they don't tell you is that there's no reduction in all-cause mortality because you have increased risk of bleeding stroke. So I guess the justification for alcohol is it's important for you to die from a bleeding stroke rather than a clotting stroke. Elevated cholesterol, also actual cause of death, probably because it's a marker for how much animal food you eat. And obesity. The fatter you are, the higher your risk factors. Eliminating the cause of obesity critical if we want to get rid of the actual causes of death. Interesting, low fruit and vegetable intake independent of weight issues as a risk factor for all-cause mortality, probably because fruits and vegetables are our only source of phytochemicals. Physical inactivity, illicit drugs, and unsafe sex. You can see that the reason people are actually dying is not deficiency things, lack of things. It's because of excess, and particularly dietary and lifestyle excess. So the big condition, the big epidemic condition today in society is metabolic syndrome. If people's waist is over 35 inches, if you're a woman, 40 inches is a man. your triglycerides are over 150 milligrams per deciliter, if your blood pressure is over either 130 or 85, if your fasting blood glucose is over 110 or lower HDL than 50 milligrams per deciliter. If you have 3 of those 5 things, you have metabolic syndrome. And metabolic syndrome is, in fact, one of the leading epidemic conditions that's responsible for contributing to a wide variety of problems, including cirrhosis of the liver and liver cancer and colorectal cancer, gout, diabetes, stroke, congestive heart failure, myocardial infarction, coronary artery disease, and many other conditions. Fortunately, some of these things are actually reversible. Here's an interesting diagram of a coronary artery before and after 32 months of a plant-based diet. No stents or bypass in this case, just making dietary changes resulted in substantial improvement. So if you're not going to eat meat, fish, fowl, eggs, dairy products, oil, salt, and sugar, eliminating the majority of calories that people consume, what's left? Well, it would include fruits, vegetables, both raw and cooked, nuts and seeds, and complex carbohydrates, potatoes, yams, squash, grains, beans, to the degree that you're able to process those. And if, in fact, all of your food contained these foods, you'd get the quantity and quality of nutrients you need to sustain optimum health, with the exception of vitamin B12. B12 coming only from bacteria on a diet where you're being hyperhygienic and avoiding bacterial contamination, and particularly animal products, including all its fecal contamination, etc. Vitamin B12 does need to be supplemented over the long run. So we divide food into 3 meals. Why do we have 3 meals typically for most people? Why don't we have just 1 meal or 10 meals? One way to think about this is if you look at the human stomach and you fill it up with these high nutrient density, low caloric density foods, you have to actually fill up the stomach 2 or 3 times a day to get enough calories in order to sustain optimum health. And so although you could go on a less volume diet initially, as long as you had reserves, eventually you deplete your excess reserves and you'd have to get enough to eat. And so for most people, that's going to be filling up the feeding bag a couple, 3 times a day in order to be able to get enough to eat. An example of a meal plan might include fruit, oatmeal, salads, steamed vegetables, potatoes, rice, and beans. And it doesn't matter necessarily so much exactly how you, which order you put foods in, as long as you get enough to eat and not get too much over the course of the day. Now, one of the things that we recommend for our patients is intermittent fasting. That is, that they limit their feeding window to somewhere between 8 and 12 hours a day, depending on the patient. So that gives them a period of 12 to 16 hours a day of fasting. And this type of intermittent fasting is enough day compounded to have a large cumulative effect in terms of biomarkers and other changes that occur during intermittent fasting. It also tends to help people limit overeating, and particularly limit overeating right before people go to bed. We recommend that people avoid eating at least 3 hours before they go to sleep, and by doing that, by eating earlier, making their final meal earlier in the day. So this type of a feeding pattern allows people to get all of their food from whole plant foods and avoid the meat, fish, fowl, eggs, dairy products, oil, salt, sugar, and other processed foods that leads to the metabolic syndrome and obesity and the problems that people suffer from. So here's some pictures of real food: fruit, vegetables, some more vegetables, some more vegetables, some starchy vegetables like potatoes or squash, and perhaps some foods like grains and beans to the degree that you're able to digest them. I'd like to do a little cooking demonstration or food preparation demonstration here. This is a banana for people that sometimes they say they don't have a lot of time, so this is for highly efficient food preparation. What you do with this device is you take it and you peel it, and then you eat it, but just eat the inside. Leave the skin alone. That's not so tasty. And now I know some people say, well, you know, that's great. That's quick and easy. I have time to do that, but I don't want to have bananas, every day. I want some variety in my life. And so what we do is we show them how to do a banana in a completely different way. You take the banana from the other direction and you peel it, and then you eat it. So maybe Monday, Wednesday, Friday, you peel it from the top, and Tuesday, Thursday, Saturday, you peel it from the bottom, and hopefully that adds a little bit of variety into the diet. So one of the big concerns that we notice clinically is that some people have tremendous difficulties with digestive disturbance and autoimmune disease. And we believe that one of the reasons for that is a process called gut leakage, where people absorb protein molecules or other molecules through the intestinal mucosa, and in genetically vulnerable people, the immune system reacts. And unfortunately, in some people, that reaction becomes inappropriate, and they may begin to attack their own tissues. And so if a person has gut leakage and their immune system attacks their colon, we might refer to this condition as ulcerative colitis or bowel syndrome. If it attacks their joints, we might talk about rheumatoid arthritis. If it attacks their kidneys, we might talk about lupus or skin vasculitis. If it's their lungs, we might look at conditions like asthma. And one of the things that all these different conditions have in common is they seem to be aggravated by gut leakage. And, you know, the mucosal membrane in the gut works very much like the screen works to keep out the bugs. If the holes are smaller than the bugs, difficult for the bugs to penetrate. However, if the screen were to become damaged, then it might allow the bugs to get access inside. And the analogy is that in people, if intestinal mucosa becomes damaged, perhaps through inflammation, which might be caused by free radical exposure, then materials can enter into the bloodstream that wouldn't normally be there, and the body's immune system would react to those things, and you'd be fine. But if that process were to continue, and a person had genetic vulnerabilities, that immune system may become dysfunctional. And in fact, that's a simplistic model that we believe may be relevant in contributing to many conditions termed autoimmune diseases. That materials trigger the immune response inappropriately. And so now the question is, what can you do about it? Now, conventional treatment often involves very powerful medications that try to suppress inflammation, and they can be like a dream at resolving symptoms. But that dream can become a nightmare because long-term use of medications like prednisone can lead to long-term consequences that are very unfortunate. And so that dream becomes a nightmare because it turns out you need your immune system. And suppressing your immune system, although it might be helpful symptomatically short-term, may not be a good long-term strategy for building health. So, here's an example of the effect of free radicals. You can tell the difference between one side and the other. One side has prematurely aged cross-linked collagen tissue, which comes, in this case, from smoking. I'll call it smoker's face. And the other has more normally aging skin that doesn't get exposed to excess free radicals. In this case, could be smoking. Other options for free radicals might be peroxidation of alcohol or eating high-fat foods, particularly heated fat foods. Lots of free radicals, lots of premature aging, and of course, it's not just the face that's affected, but all the organs and the tissue in the body. Maybe why smokers are protected in many cases from lung cancer because the enamel lining of the vessels is damaged and they get heart disease and die from heart attacks before they live longer. So we believe that the hidden force that undermines health and happiness is, in fact, the pleasure trap. And we believe that escaping the pleasure trap, including the dietary pleasure trap, is a critical component to overcoming diseases, including autoimmune diseases and diseases involving the gastrointestinal system in particular. And in order to escape the pleasure trap, requires people to recognize that these chemicals added to their food have a drug-like effect on them. And so that's why we advocate an exclusively whole plant food, SOS-free diet. We've actually produced a couple of books, the Health Promoting Cookbook, the Ramses's Bravo, and more recently Bravo Express. And these are all vegan, SOS-free cookbooks that provide simple-to-make recipes so that people that are choosing to avoid animal foods and processed foods have recipes that are simple and possible to make, even for people that aren't gourmet chefs. The other intervention that we use is medically supervised water-only fasting. In some cases, we'll take patients for 5 to 40 days, put them on water only in a medically supervised setting which allows the inflammation to be eliminated, allows the gut to heal. And then when you apply a whole plant food SOS-free diet, we find that many of these patients are able to overcome their chronic inflammatory conditions, eliminate the pain and debility, and restore their health. The trick is, though, you have to keep eating a health-promoting diet and lifestyle in order to sustain the results, because fasting doesn't cure anything, but it's an effective management strategy to get people to the point where good foods taste good and their acute symptomology can be resolved.
Wow, that was amazing, Dr. Goldhamer. I'd love to ask you a few questions about this if you'd like to stop sharing your slides so that I can see you. Thank you so much. So, Dr. Goldhamer, I agree with you. I have followed a plant-exclusive diet for over 40 years like you, and for the last 12, one free of sugar, oil, flour, alcohol, and salt. However, so many people that I come in contact with, and I'm imagining some of your patients too, say they can't eat fruits or vegetables or beans or grains or nuts and seeds because of some pre-existing GI conditions. So how do we get people even into the conversation when starting out, they perhaps really can't eat some of these things?
Well, the good news is you don't need to eat all of the different classes of food. All you have to do is find out which foods within the classes of foods that are available are within your digestive capacities. And then over time, as you heal, you may be able to broaden your dietary intake. And the advantage of broadening the dietary intake is it provides more variety, it provides more ability to adapt to seasonality, and it also gives us diversity of nutrient exposure. So there is an advantage to being able to eat a diverse whole plant food SOS-free diet, but it's not a necessity. For example, some people don't do well with nuts or seeds. So they may find they're difficult for them to digest, or it's difficult for them to not overeat on. So they may have to limit or eliminate some or all of that class of foods. Some people don't do well with beans, for example. They have digestive problems with beans. Now, there are things, for example, you can do with beans that make them more digestible for some people. If you soak those beans overnight, if you boil, drain them, and pour off the boil water, and then cook beans slowly, and significantly reduce the quantity of beans you're trying to eat, sometimes people find that then they're able to eat at least some of the beans without digestive distress. Some beans, like lentils, may be easier to be digested than maybe other larger beans. But some people just don't do well with beans also. You can eliminate them. There's nothing that says you have to have any one particular category of foods in order to sustain optimum health and nutrition. Some people have certain vegetables that they're sensitive to. There may be whole classes of vegetables that some of the cabbage family vegetables sometimes cause people difficulty. So again, what we need to do is, first of all, get the gut as healthy as possible. That's why we like to use fasting and other things to kind of reboot that gut microbiome. People forget they have multiple pounds of bacteria living in their gut that are an instrumental part of their immune system. There could be up to 5 pounds of bacteria, 1,000 strain of bacteria living in the digestive system, protecting you and keeping everything in check. But when you take antibiotics or you go on highly processed food diets, you may end up with a completely different microflora than you would if you were on a healthy diet. And those trillion creatures are living creatures. They're eating, drinking, and defecating inside you right now. And if I want my bacteria pooing fertilizer into me. I don't want it pooing things like TMA, trimethylene oxidase, that can cause damage to my blood vessels and increase my risk of other problems. And so I know I need to feed my bacteria the food they're designed to eat in a healthy human gut, which is soluble fiber. So it's going to be vegetable material. Now, some people, for example, can't eat a lot of raw vegetables because they find it causes them distress, but they may be able to do well with steamed vegetables or blended vegetables. There's lots of different ways to process food to reduce some of that initial difficulty. And sometimes it's just patience. If you continue to expose yourself to increasing quantities of plant-based foods, the bacterial flora in your gut changes, your digestive capacity changes. There's things you can do besides cooking that increase digestibility, and one of those things is called chewing. It turns out that the process of chewing food not only breaks it down mechanically, but it stimulates digestive secretions. And so one of the problems many people have with digestive problems is that they eat too much, they eat too fast, they eat the wrong foods, And so if you start eating less and eating the right foods and chewing those foods properly, and perhaps be sensitive to the complexity of your meals. Sometimes people use various food combining tools to help simplify their meals. You may find that you can eat a wide variety of foods with good success, whereas those same foods eaten too quickly, not treated properly, not prepared properly, may become distressing.
Right. Just in case someone watching this summit isn't familiar with the term water fasting or therapeutic medically supervised water only fasting, can you explain what that is if a patient with any kind of medical condition, specifically a GI condition, were to come to you, what that process would be like for them?
Well, the two types of fasting they're commonly referred to as intermittent fasting, where people limit their feeding window to, say 8 hours a day and fast for anywhere from 12 to 16 hours each night. That can be done safely by almost everybody. Doesn't require manipulation of medications. It just means don't eat 3 hours before you go to bed. Don't eat too early in the morning. And hopefully when you are eating, eat a whole plant food SOS-free diet. And the benefits of that is it helps people limit overeating and may induce biochemical changes that are thought to be helpful. And then the other type of fasting is medically supervised fasting. This is fasting that's done in a medically supervised setting for prolonged periods of time, anywhere from 5 to 40 days. And so these patients undergo a proper physical examination, have baseline laboratory evaluations done, and they're in a controlled setting with doctors that are experienced in doing this type of program. This is a safe and effective process for resolving a variety of conditions associated with dietary excess, including cardiovascular disease, type 2 diabetes, autoimmune diseases, and even conditions like lymphoma are shown to be effectively treated with this intervention. Again, the problem is afterwards you still have to go back to a whole plant food SOS-free diet. You can't go back to the greasy, fatty, slimy, dead, decaying flesh and not expect problems to recur. So this is something that we do at True North Health. We've done it for 36 years. There's been well over 20,000 people that have successfully undergone medically supervised fasting. We are able to do this, but again, that's something that really is usually done when dietary intervention and intermittent fasting alone have not been sufficient to help a person overcome their problems. Or you have patients, sometimes they're on medications and other problems. You have to go through the careful process of withdrawing those medications in order to undergo fasting, and that does need to be done in a controlled setting.
Right. Do you know what effect fasting does have on the microbiome, whether it's water-only fasting or intermittent fasting?
Well, we've done the first study that I'm aware of on long-term water fasting and the effect on the microbiome. We did that with our colleague, Luigi Fontana from Washington University. And what we did is we took subjects before and after fasting, took samples, and they are now going through the complex process of evaluating the changes in both the type of flora and also what those flora give off. Unfortunately, that data has not been released yet, so I can't share with you the specifics. What I can tell you is clinically it looks like it reboots the microbiome. It's very much like taking a computer that's been corrupted, and you know how you turn it off and you turn it on, and you may not know exactly why, but now everything starts working again. Well, that's what it looks like is happening with the microbiome, is that you shut it off, there's a significant reduction in bacterial volume, and then when you reboot it, hopefully on a healthy diet, it appears that the body is able to help reestablish a more healthy flora. Again, hopefully as that data becomes available, we'll be able to share the specific results of that.
Well, I look forward to be able to share that. That sounds fascinating. Why is it important for people in general and people with GI disorders in particular not to be eating late at night?
Well, you know, when you eat late at night, first of all, your own ability to do effective digestion can be limited, and then particularly when you try to go to sleep, there's a contradiction going on where your body's trying to rest and recuperate and go through that process, but is also being actively stimulated by, a rather energetic process of digestion. So it can affect the quality and quantity of your sleep. It can lead people to having to wake to deal with bowel and bladder issues. And just the increased activity can affect some important healing that's supposed to take place, particularly during non-REM deep sleep. And so the quality of sleep can be affected. The quality of digestion can be profoundly affected. And also, you want, when you're eating food, you want your food to be burned for energy, not stored as fat in most people's cases. And so, better to eat those calories at a time where you can burn them, and then the body doesn't have to actually preserve them as additional fat. For most of us, we're trying to stay leaner, not improve our fat storage efficiency.
Right. A lot of people with GI disorders are put on a very low fiber diet by their doctors. Why is this not really a good thing long term, and why is fiber so important?
Yeah, well, what sometimes is good for short-term symptomatic relief is not always good for long-term health recovery. And though it is true that sometimes you have to limit how much fiber or the type of fiber that you introduce to a patient with debilitated digestive system, ultimately we're trying to move back into normal digestion, which is absolutely critically dependent on adequate soluble fiber intake. That's the food that the bacteria flora you want living in your gut need to eat. And you don't want them to have to resort to breaking down your own tissues in order to be able to survive. So I think that it's critical that we move back into a diet that's adequate in fiber. Fiber forms not only the food for your bacteria, but also the bulk of your stools. I mean, when you think about the diet that people eat in our society, meat, fish, fowl, eggs, and dairy products, how much fiber is there in meat?
None.
None, yeah. What if it's organic meat?
None.
Yeah, it's still none. Yeah, it doesn't change. Same thing with fish, fowl, eggs, dairy. There's no fiber at all in any animal foods, only in plant-based foods. And so if a significant percentage of calories is coming from animal foods and another significant percentage of calories is coming from sugar and oil and refined carbohydrates, also which don't have any fiber, you have to get all of your fiber from a very small amount of calories or significantly overeat in order to be able to get some higher fiber food. And the consequence of that is just what you see around you. When people don't get enough fiber, they get constipation. When they get constipation, they strain and they get hemorrhoids and fissures, varicose veins and prolapsed uteruses, and a whole host of internal organ disruption. And these conditions were very rare in societies where plant-based foods were eaten. Now they've become epidemic. And so I think that it's incumbent upon us to get into a diet that's consistent with our biological design, and that's going to be a whole plant food diet. And we recommend avoiding the chemicals, salt, oil, and sugar. And the consequence, you get a normal flora, you get normal bowel function, and you can eliminate some of the overeating that leads to obesity and metabolic syndrome, and this whole cascading event of immunological compromised individuals. Isn't it interesting that 500,000 people are dying this year from coronary artery disease? That's 500,000 people. Tens of thousands of people dying from diabetes. Thousands of people dying from the consequences of dietary excess. And now we have new concerns about acute infection like COVID infection, where so far 100,000 people has died this year. And many of those people are dying because of an autoimmune type response that occurs to happen in the consequence of the illness. And the risk factor for those consequences are metabolic syndrome, it's obesity, diabetes, coronary artery disease, respiratory distress, compounded by age, which is really nothing more than how many years of abuse you've had, and smoking. And so, people are not asking, why is it that some people get sick and they die? And other people get sick and it's relatively inconvenient, but not necessarily devastating. And one of those differences is how healthy the person is. So you want to be healthy, not just to avoid getting heart attacks and strokes and cancer, but also so that when you inevitably get exposed to the various organisms that are abundant in our environment, that you survive, you recover, and you don't succumb as a consequence of a compromised immune system.
Wow. Dr. Goldhamer, a lot of people are put on something called a low FODMAP diet, a low fermentation diet, a low residue diet, or an elimination diet. Are you able to work with patients that are coming to you with one of those 4 eating styles?
Well, certainly, and again, different sensitivities in different people. What we're always attempting to do is to improve the overall gut health enough that the diet can be as varied as possible. But you have to recognize that different individuals have different limitations. And one way we test that is actually, you can do all kinds of LCAT and RAFS testing. There's lots of different tests that have very serious limitations. But one thing that's pretty much low tech but proven is rotational feeding, and particularly rotational feeding after fasting, once the gut's had a chance to heal, and you introduce foods one at a time and watch for reactivity. And what we've learned is that some people just can't eat certain foods at all. That's it. And some people can eat those foods, but maybe they can only eat them once a week, not necessarily every day. And so you have to build a diet around, rotation. And sometimes people that are sensitive to foods at first, over time, they become less sensitive as they heal. And, so again, it's not a simple process. And in fact, some of the more complicated conditions to treat are these conditions of inflammation in the GI system, because, such an important part of our health and immunity involves the GI system. When it's compromised, it has a profound effect on overall health, and helping that recover can be really quite challenging.
How long does it take for these people to heal? And have you worked with people even with some severe conditions like, say, ulcerative colitis or Crohn's disease? Was there hope for them?
Yeah, there is absolutely hope. And again, ulcerative colitis, Crohn's disease, and even the more common irritable bowel disease can be really debilitating to people. It's interesting. We have lately, because there's been a little bit of delay in people being able to check into the center because of the backlog. We've been working with more people on the phone and helping them with diet and lifestyle changes. And we have some of our doctors, like Dr. Varese, that does a lot of phone coaching. And I gave her trouble sometimes, because many of these people that I talk to, and they start working with her while they're waiting to come in, go and get well before I even get to see them. So I give her a hard time because many times all you have to do is get the diet right. And you just change the diet to a whole plant food diet, and then the body recovers, and they don't necessarily have to go through the vigorous process of medically supervised fasting. And so now we've actually, we're launching next week, actually, a new sophisticated phone coaching system where people can actually go on through our website, log on, and then they can set up consultations with various attending doctors on our staff. And we're also looking at trying to provide coaching services just to encourage people on an ongoing basis and deal with these very challenging issues. So for many of our patients, they're able to do that remotely. They never have to come in. They just have to get the diet right. But for some people, despite our best efforts at working with dietary manipulation, or people just don't feel like they can make the dietary and lifestyle changes on their own, they're just too exhausted from being ill, they need to come in to True North. We put them into the facility. We work with them on a controlled basis, and whether it's fine-tuning the diet or going through fasting or modified fasting, and often those results are very, very encouraging. And you can go on to the foundation's website, fasting.org, and look at all of the case reports and studies we published that show what is possible if people are willing to do dangerous and radical things like eat good and exercise and go to bed on time and consider things like fasting.
Wow. You had mentioned IBS, and there are people that have IBS and also have SIBO with it. And for some people with SIBO, the antibiotics don't work. Will a water fast resolve SIBO in some people?
Well, for some people, the reason they have SIBO is because of attempts to use antibiotics to treat problems. When you take antibiotics, you can wipe out a large portion of your flora, and the type of flora that grows back, particularly on these SIPI diets or these animal-based diets, is not the flora that's consistent with recovering health. And so what we'll often do is use fasting to kind of reboot that system and then carefully reintroduce a whole natural food diet. But again, I want to emphasize, for example, we like to use raw and cooked vegetables, but not everybody's able to, for example, handle a lot of raw vegetables at first. And so we may need to use an exclusively cooked vegetable-based diet at first. Or sometimes you have to process the vegetables and blend them into soups and other things to ease the body's ability and kind of retrain it, if you will. So this is a highly individual type of intervention that's necessary to be successful. But I'd have to say that the majority of people that we see, even with these very debilitating symptoms, if they're willing to really put their effort into it, it's really gratifying how successful people can become. And I particularly like these patients because once they get well, they're usually so grateful for getting well, they're willing to keep doing the diet and lifestyle change. There's nothing better than pain, debility, or fear of death to motivate patients into dietary change. So I find patients that are facing pain, debility, and fear of death to make really the best patients.
Wow. So it's possible that some patients can't water fast. They can't medically get cleared. So your other levels of service, like the unrestricted feeder or the juice feasting or juice fasting, can that also help people with some of these chronic GI conditions?
Yeah. Sometimes we'll do juice fasting because with juice there's no fiber, so there's nothing to stimulate or irritate the bowels, and it gives you a chance for the bowels to heal, and then carefully reintroducing fiber into the diet, usually through steamed starchy vegetables and other foods of this nature. can be successful at allowing bowels to begin working again. I've had patients that haven't had unassisted bowel movements for decades, literally. And yet you do a fast, you get them feeding, and now the bowel function is restored. And, it's the rule, not the exception.
You mentioned that chronic constipation. I know people that honestly, they really do eat like you and I, and they have had chronic constipation for years. So you're telling me that sometimes even a fast could get things moving?
Well, actually, what fasting can provide a rest, and then an appropriate diet is allowed to reestablish normal bowel function. I haven't actually seen patients that aren't able to establish or reestablish bowel functions so far, but perhaps in the next 36 years we'll run across one or two. But bowel function is pretty mechanical. It's predictable. Sometimes it can be kind of a pain in the butt, but it is definitely one of those conditions that we expect to resolve. And in fact, generally, we want to see normalized bowel function even before we start fasting. And usually we can achieve that just by getting rid of a lot of the medications that contribute to it, the dietary, inappropriate diets that contribute to it, and also stress. The bowels are largely impacted by emotion. Because the autonomic nervous system, the parasympathetic and sympathetic control peristalsis. So sometimes just getting people in an environment where they're not so stressed out is enough that allows things to start to function again. And so, we can't underestimate the fact that stress may have in contributing to some of these patients' problems. So somebody may be eating well, but they may be living in a high stress environment, or driving 2 hours a day to a job they hate, working with people they dislike, for company they detest. They may be doing things they don't like. So all kinds of reasons why people have dysfunction. And it's not always just diet. Diet's just the thing that's perhaps the most profound and the easiest thing to perhaps try to address. Sometimes it's easier to control the diet than it is to control, the environment that some people are having to live in.
Well, that's what's so nice about a visit to the True North Health Center, because they can make these changes in an environment of rest and relaxation.
Yeah, they say that there's two things they call us. They say it's True North Health Center, the last resort. And they also say, Dr. McDougall says that we're the punishment. If somebody doesn't get well on their own, then he apologizes and says, yeah, they might have to work with us.
Love Dr. McDougall. So a lot of people I know, including people that are on what you would consider a healthy plant-based diet, seem to suffer from acid reflux or GERD, and they're taking proton pump inhibitors, and many times for years. Have you helped people get off of these? And why is it not good to take these medications for the rest of your life?
Well, these medications can have profound negative effects, if nothing else, immunologically. That normal gastric acidity is a necessary part of protection and balance. And so if it's too high or too low, you can get very unfortunate consequences, including gastric ulcer disease and sometimes significant changes in the esophagus. You can also have problems with digestive difficulties because of imbalances. And there are cases where sometimes you have to do medical intervention with digestive enzymes and other things to try to bridge the gap while people make recovery. But in general, what we're trying to do is get people off all the pills, potions, and powders. I can't say how many people just getting them off all the supplemental nutrition that they were taking was helpful in reestablishing normal digestive function. Sometimes those concentrated pills and potions are doing much more harm than good. And certainly that's true with long-term medication use. You can get very unfortunate consequences. Having said that, let's face it, that the recognition that H. pylori bacteria can help prevent gastric ulcer disease from healing has really revolutionized the treatment of gastric ulcer disease, and the use of antibiotics has been, very helpful in terms of dealing with that condition. The problem is it also has side effects that have to be dealt with, and if you follow that treatment with a poor diet and lifestyle choices, it can become compounding. But we don't want to deny the fact that appropriate medical intervention can be the difference between life and death and can profoundly affect the quality of life. And we oftentimes are working with gastroenterologists for necessary medical treatment that can be absolutely fabulously helpful. It's just that when medical treatment isn't followed by health-promoting diet and lifestyle factors, it can become part of the problem and rather than the cure.
So I've known people that are on so much Prilosec and they sleep with their bricks, on their bed. So you've seen that improve in some of your patients.
Oh yeah, well, and sometimes we will also use mechanical elevation of the head of the bed and other things to provide mechanical advantage. But then eventually, as people heal, they can go back to not having to do that type of intervention. So people are able to get well. But again, it's not an easy situation, and you do need a high degree of compliance in order to be able to sustain long-term results.
Right. So you mentioned a lot of people are chronically constipated. A lot of times when I tell people about a plant-based diet, eating more fruits and vegetables, they say the opposite happens. They actually have too many bowel
Yes,
movements and get diarrhea. So
yes,
then they want to give up because they don't like running to the bathroom very often. So what
right.
do we do for these people?
Well, initially, there's two things that happen with diarrhea. One is if you try to get too rapid an introduction of change in diet. People's colons are so debilitated, they're just not used to any of the stimulation that comes from fiber. Obviously, the reason why most of these patients' constipation resolves is they get normal stimulation from normal food and bowels go back to functioning normally. But if a colon is very debilitated, you may have to gradually introduce these. And also, it's compounded by detoxification. When you get people off a greasy, fatty diet, they start dumping a lot of those excess bile acids. And the excess bile acids, that's that green, yellow pigments that can be so caustic and irritating, will cause a little bit of diarrhea as the body flushes this material out. A plant-based eater only has about 20% of the average circulating bile acids that a high-fat eater would. And so, initially, those excess materials have to be eliminated. That may also be why plant-based eaters have a lower incidence of bowel cancer and other things. Perhaps excess exposure to excess amounts of bile acids may be part of one of the reasons why chronic irritation may be set up. I don't know if that's been proven yet, but it's certainly an interesting correlation between the high animal food intakes, higher bile acid production, and higher incidence of chronic GI irritation.
A lot of times people, when they first adopt a plant-based diet, maybe they don't even have any GI disease, they complain of gas. And
Yes.
is there any way to make that transition easier?
Yes. Well, first of all, think about what gas is. It's bacteria breaking down carbohydrate that hadn't been fully digested higher in the tract. And so there's nothing about gas per se that's necessarily a health threat. It's more of it. It can be distressing if the bowels aren't working properly. You can get pain. It can be socially disturbing, but it's not in and of itself a significant health threat. But if you want the gas to go away, then you have to get rid of the reason why you're forming excess amounts of gas. Now, I think all plant eaters, humans and animals, will have some bacterial action, which is a critical component of the function in the bowels. And so there's going to be some gas material, but it doesn't have to be distressing. The things you can do to reduce gas, number one, is stop overeating. When you overeat your digestive capacities, then carbohydrates move farther down the chain and you get more bacterial action in breaking them down. So stop overeating. Chew your food thoroughly. Chew your food to a liquid. Don't, people say, well, I chew my food. I say, what happens when you eat corn? Do you see corn in your stool? And they say, well, I don't look at my stool. If they do look at their stool, they'll see corn. Well, what does that mean? What do you think? The corn went back together? No, you never chewed it up. It doesn't go get chewed up and then reform. And so what you have to do is chew your food. And if you're seeing food showing up in your stool, it means you didn't chew it. So, and if you don't chew it properly, you're going to have more gas than you would if you chewed food to a liquid. You can also process food. You can use a food processor. You can use an S-blade to help break down food farther so that, you still have to chew it, but you get more complete food processing. Sometimes people don't have all their teeth or they don't have good dentition, and so they may need to use food processing to get chopped salads or things so that they're able to masticate it adequately to allow good digestion. You can use more cooked food or cook food a little bit more thoroughly in order to be able to break food down with heat. So the heat dextrinizes the starch, just makes it more digestible, be a little bit less gas formation. You can be careful about gaseous foods associated with higher gas production, like cabbage family, like the beans, etc. So you might use more zucchini and squashes and Hubbard squash and butternut squash and potatoes. And at first, as your body gets used to digesting more plant-based foods, you can be careful about high sugar content foods, particularly dried fruits, fruit juices, things that you probably shouldn't be using in concentration anyway, or even too much fruit can be a real challenge, especially for diabetics or people that have colitis. There are certain types of fruits, sometimes citrus fruits are a particular problem, particularly if they're taken in the forms of juices. Fruits that have not been ripened properly, so they're going to be higher in acid. All of these things can be factors. Some people are sensitive to certain categories of food, proteins in food, so they might be, the nightshade family, for example, might be a problem for certain people with certain symptoms. Although it's interesting, AJ, some people say, well, they're nightshade sensitive, but what they really are is they're tomato sauce sensitive. They might be able to eat fresh tomatoes and do okay, but when they eat highly concentrated, high acidic things like a tomato sauce, they may have reactions, or it may not even be the tomatoes, it's the oil, the sugar, and the salt that's in the sauce they're eating, and they've attributed it to tomatoes. So sometimes it takes a little testing or investigation or rotational feeding to really get down and figure out exactly what it is that is causing people distress.
So if I understand you correctly, there's no one particular food that all humans must eat, and there's always going to be some version of a whole food plant-based SOS-free diet that people can adopt, often with the help of the doctors at the True North Health Center.
I couldn't have said it better.
Okay, great. So why do you think these GI diseases are so prevalent? Why do so many people have GERD and IBS and SIBO and diverticulitis and diverticulosis and chronic constipation and, just ulcerative colitis, Crohn's disease? I mean, these are common diseases
But those
now.
are that's what happens to human beings that eat a diet that's dominant in animal foods and highly processed foods. Those are the modern diseases of dietary excess. So I'm only amazed that more people don't have those problems. I mean, it's remarkable to me to see the material, the diet diaries that patients are coming in, and like how they live as long and as well as they do, to me, is quite remarkable. In any case, so we know the cause of these problems and we know the resolution of these problems. The difficulty is that people are addicts and they don't want to quit smoking, drinking, and eating meat and highly processed foods. And also society is set up to give people what they want, not what they need. And so it's easy and convenient to go out and get access to the highly processed foods. You have to actually do some work to live on a whole plant food SOS-free diet. You have to shop and put some effort in, because you're such an extreme minority when you're trying to live healthy in this world. But, it's like saying, why are 2/3 of people fat? Well, it's not like random. It's not a mystery. It's because of what they put in their mouth and what they're not doing with sleep and exercise. And it's not like surprising that people have GI problems. Look what they're putting in their mouth. They're inducing the condition with their diet and lifestyle.
Well, I agree with you. However, we both know people personally who do follow your diet to the letter and still have succumb to things like SIBO, IBS, and have unrelenting bloating and distension. So
No question.
there are some people that you would agree are plant perfect eaters that still have these. How
Because
do we
it's
help?
not just diet. Diet is important to control, and even those people still have to control their diet. But there may be other issues that have to be addressed. In some cases, there's enzymatic problems. People don't produce certain enzymes, and so those are going to have to be supplemented or replaced. Other people have structural damage. They have adhesions. They have endometriosis. They have all kinds of things going on that might be compounding their problem. Some people are on necessary medications that have untoward side effects. And so you have to figure out, how to deal with that. Some people, it may not even be diet. It may be a largely stress and environment-induced problem. That people have toxicity problems. So a lot of people, and some people have infections, whether it be parasites or they have bacterial infections, they have viral infections. So, and many of these challenges have been going on for years or decades. And so, you have a problem for 25 years and it doesn't resolve in like a week. You can't necessarily assume that it's not resolvable. I've had patients where it's the third fast before they get symptomatic relief, with months of feeding in between. And so, it's not always quick and easy. Now, I prefer to have patients, they come in and they get well before they get there, or they get well right away, and then they go out and tell everybody how easy and simple it is. But that's not always the case. Sometimes it's a hugely complicated, complex, and sometimes even requires medical management. I'm so excited right now because I'm so rare for me to see patients that actually benefit from medication. But I have a patient right now at the True North Health Center that had a very rare and very dangerous cancer that has come in and responded to immunotherapy. And it's very clear, and we were already doing the diet and the lifestyle stuff and everything we could do. And, this has been, we're writing this up right now, and has done well without secondary effects, I think in large part because he's living healthy and all the rest. But, there are situations where, medical care is really a miracle. And so it's so gratifying to see that happen occasionally because, we're always criticizing conventional medical treatment, particularly medications with all their side effects, because frankly, the people we see are usually the people that didn't respond or they wouldn't have had to be coming in to begin with. And yet it is nice to see that sometimes those interventions actually do work. And so that's kind of cool.
That's nice. And I like that you said that sometimes people don't respond the first time because a lot of times they've had these conditions for a long time, and getting some improvement is still better than not improving at all.
Well, and I know usually exactly how long it'll take. It'll take however long it takes to resolve the condition. And then in hindsight, I can predict with 100% accuracy how long it took. But we just don't know in advance how long it's going to take. We guess. And, some conditions are easier to predict than others. Like with weight, we can predict weight loss. But do you think there's a difference in some people losing weight than others? You betcha. Males lose an average of 3 pounds a week. Females only lose 2 pounds a week. So there's a big difference just in the sex of people.
Do you ever recommend things like probiotics, prebiotics, or digestive enzymes?
Personally, I'm not a fan of pills and potions of any kind. I kind of hate everything. But the doctors that work on the staff at the Trinity Health Center that are actually the attendings of the patients are much more open-minded, and they're willing to consider the good and the bad aspects of both conventional medical care and alternative care. So it's a good thing for our patients that I'm not the one making the recommendations, because I would always look at diet, sleep, exercise, and fasting and continue to grind on that till the problem gets solved. But I do have to admit that in some cases, both for expediency, in other words, how long do you want to suffer before you get well, and also for ultimate outcome, some people do better when they get a good combination of appropriate medical treatment along with conservative care. And that's why we've hired doctors that are not idiots. And they are open-minded, but they're not so open-minded that their brains fall out. So I'm very pleased with the staff we have because they can work with people where they're at, addressing the dietary issues, addressing the medical care issues, addressing the naturopathic medicine issues, and even the mechanical issues, the chiropractic, the exercise, the physical rehabilitation. All of these therapeutic modalities have potential for a given individual, but I don't think they can replace the need for a whole plant food SOS-free diet for people that want to get and stay healthy.
Well, you mentioned exercise. How important is exercise to gut health?
Turns out it's really important because when I mentioned before that there seems to be a strong tie for some patients to psychological and stress-related issues, and exercise undoes the consequence of dietary excess and helps undo some of the consequence of stress. So it has a profound effect on the autonomic nervous system. The autonomic nervous system has two components, the sympathetic and the parasympathetic, and they work in balance with each other to keep things in check. If the sympathetic nervous system gets too high, you might have symptoms like constipation. If the parasympathetic tone gets too high, you might have something like diarrhea. So the things that can affect the autonomic nervous system balance, not just diet, but also stress and exercise. And so keeping that autonomic nervous system in balance is why we've invented all these natural therapy systems like massage, biofeedback, acupuncture, homeopathy, chiropractic manipulation. You name it. These systems all have one thing in common, is that they work by balancing the autonomic nervous system. Now, I say some things work better than others, but if you look at how is it that they relieve the pain of people, largely it's getting that autonomic nervous system, that sympathetic parasympathetic balance back in place. Now, the one thing that's the most powerful way of doing that I've ever seen is actually fasting. Fasting works like rebooting the hard drive in a corrupted computer. It's remarkable how that autonomic balance seems to correct after fasting. And, we'll be looking at these biomarkers more in research that we're going to be doing this year, that I believe that it works in sick people, but I also believe it works in healthy people. And I think that we're going to find that some of the people that get the most benefit from fasting are healthy people that use it maybe for a short period of time periodically in order to maintain normal microbiome, normal autonomic tone.
Wow. That makes sense. I really appreciate what you said about how how important it is to chew the food to the cream, because I think that is a big problem with a lot of people. You'd mentioned in your slide presentation that Americans eat something like 93% of their calories from animal products and processed food, which means they're not eating any fiber. But when you think about it, those foods basically don't require chewing,
Right.
Cinnabons, chicken nuggets. And so people, it's almost like they've lost their ability to chew.
Not
So that when you,
almost. AJ, they've lost their ability to chew their food. They come into our clinic and they go through a fast and they get tired because they've gotten muscle atrophy from not having used their jaw muscles. And one of the things you'll notice in people that are plant-based eaters is they tend to have much better muscle tone, and also I think it affects dentition as well. Because you literally you get an atrophic effect that occurs from people never just swallowing and inhaling their food. The other thing about chewing your food is it not only improves digestion, but it slows you down a little bit, and it tends to allow your brain to catch up with the volume so your satiety mechanisms kick in. So people tend to eat less. Also, if you chew your food, you can rip it apart with your teeth and get the flavor from the natural food. You don't have to just have stuff with the flavor sitting on the surface of the food in the form of salt, oil, and sugar. And so when people are used to eating greasy, fatty, processed, dead, decaying flesh, and they go to eat whole plant foods, they often don't enjoy the flavor very much because they're not actually turning the food apart to release the flavor to your taste perception. Also, we've done a study at the True North Health Center on taste adaptation. We've actually been able to show that there's a change in perception to salt and sugar, and most importantly, a hedonic change, a perceptive change to liking salty, fatty foods after fasting. People's tastes and perceptions actually change. And what we believe is happening, they're rebalancing back to their more normal level. And you'll see the longer people eat whole plant foods, the more they like whole plant foods. And part of that is getting it chewed up properly.
that makes sense. A lot of times just people in life get a stomach ache, they get nauseous, and they're always looking for something like what they can eat to relieve it. But isn't it true that maybe sometimes not eating is the best thing to do rather than looking for a remedy?
Yeah, well, a lot of times doing less is having a bigger effect than trying to do more. But people are kind of programmed to think in terms of deficiency. They must be lacking something. The reality is in modern society, in industrialized countries, most people are sick from metabolic syndrome and obesity and consequences of dietary excess, not deficiency. You're not seeing a lot of protein, calorie malnutrition walking around the streets in an industrialized country. In fact, the only time you really see deficiency syndromes tends to be in people that are getting most of their calories from something like alcohol.
Do you ever recommend things like maybe a little ginger or mineral water or peppermint tea to kind of calm down? Just not people
Well,
with
it is true that there's some evidence that some of these substances may have a calming effect on some of the symptoms associated with nausea. In fact, we take distilled water and carbonate it for people that have nausea during fasting, and there actually is a study that shows that it actually does work. And peppermint has some advocates. We have a number of naturopathic physicians on the staff at True North Health, and they've got a lot of these things that they use with people. I'm not quite as nice a person as the doctors that are actually caring for the patients here. They're always trying to keep people comfortable and worry about them. I think that some of that suffering may be actually beneficial in the sense that, if they suffer enough, maybe they won't want to have to come back, and so they'll stay on a plant food diet so they won't have to fast again. But the doctors that work at True North Health actually have a little different attitude, and so we do actually some of that type of intervention trying to help people be more comfortable during their fast.
Great, thank you. A couple of times when I was working at the True North Health Center, I met people that are actually missing parts of their GI tract. Like I've
Yeah.
met a couple people that have had gastric bypass surgery. I even met a young man once that was missing his colon. I think it was because he had such severe ulcerative colitis.
Yeah.
For people that are, is there still hope for those people?
Oh, absolutely. In fact, it's remarkable how well some of these seriously compromised individuals do once they go on a whole plant food diet. And sometimes those are the most dramatic and rewarding case reports because you see their history and you think, oh my goodness, what can we do? And yet they oftentimes adapt. But again, you have to modify sometimes the diet. It may not always look exactly like what you or I might be eating in order to get them the nutritional density that they need. It's like, not everybody struggles with being overweight. Some people struggle with being underweight. And, sometimes we get raised eyebrows from physicians when we advocate fasting for an underweight individual. And what sometimes people fail to appreciate is a short fast in an underweight individual can sometimes make the difference so that they can then on the same diet begin to absorb their nutrition better. And so sometimes to recalibrate the gut microbiome, we'll do a short period of fasting, even in an underweight person, because we're trying to help rebuild them and help them regain. It's actually harder on average to treat underweight than it is overweight. Overweight, it's just a question of getting them to eat enough low density foods and high nutrition foods. With underweight, it's quite the opposite. For example, if we're trying to get people to lose weight, we want them to eat their salads first, and then their steamed vegetables, and then their more concentrated foods. And if they still think they're hungry, go back and have another pound of salad. With an underweight individual, sometimes we have to reverse the order. We'll eat a little bit more of the concentrated foods first so they don't fill up so much that they can't get enough caloric density in. So you can't be afraid to manipulate quality food processing in order to meet the individual's needs. There is no one diet that I've seen that meets absolutely everybody's needs in all circumstances. So we have to be flexible enough to make the person in front of us be the determinant.
That's great. Thank you. So, Dr. Goldhamer, what's the truth about GI health?
Well, the truth about GI health is the same truth about health in general, is that health results from healthful living. And healthful living involves diet, sleep, and exercise. And if you want to get healthy, you have to pay the price. And that price is healthful living.
Thank you so much, Dr. Goldhamer.
It's my pleasure.